How to know if you are pregnant. A basic, over-the-counter pregnancy test is the most accurate indicator of pregnancy available. Also, physical changes may indicate the early stages of pregnancy. Not all women have these early changes, nor does having one or more symptoms do not necessarily mean you are pregnant. But knowing common indications can help you understand the changes you may experience in the dawn of a pregnancy. Recognizing the signs. Consider your actions. Obviously, you need to have had sexual intercourse to get pregnant, although not necessarily penetration. Did you have sex without a condom? Did a condom break? Did you forget to take your birth control pills? If you did things that put you at high risk for pregnancy, that will play a huge role in determining if you are pregnant. However, if you used protection and took other precautions, you probably are not pregnant. The failure rate of most protection options are very low. Not zero, but low. Pulling out, however, is not an effective birth control method. Notice when you've missed your period. Some women track their cycles, and some don't, so you may not notice that you haven't had your period until a little while after you've missed it. Think back to the last time that you had your period. Attach the timing of your period to an event. For example, were you menstruating when you went on a vacation or when you went to a concert? If you haven't had a period in more than 30 days, and you're sexually active, then you could be pregnant. If you have an irregular period, then you should test for pregnancy often if you are sexually active. This is especially important if you drink alcohol regularly, smoke or use recreational drugs so that you don't harm the fetus during the first trimester. Look for implantation bleeding. If you had a small amount of bleeding or spotting at the time your period would normally happen or before or after when your period normally happens but your period did not occur at its normal time, you may have experienced what is called implantation bleeding. This is a sign of pregnancy. Look for changes in your breasts. When you're pregnant, especially for the first time, breast changes are typically the first sign. Your breasts may feel sore and tender. They will definitely get larger, and your nipples may grow and darken. 1. Be aware of nausea, vomiting, or other digestive abnormalities. Many women but not all experience morning sickness when they are in their first trimesters. Often, the sickness is accompanied by a strong aversion to certain smells, like the smell of coffee. Some women start to feel dizzy often. Some women also get constipation. Pay attention to fatigue. The first trimester is often accompanied by feelings of extreme tiredness. You may find yourself wanting to go to bed early or take naps when you're not used to needing so much sleep. Keep an eye out for mood swings. The hormonal changes of pregnancy can affect your moods, causing you to be euphoric one minute and crying the next minute. Sentimental movie scenes or passages in books could cause you to become highly emotional. You may also find yourself completely unable to look at stories in the news or in books about harmful things that happen to children. Take note of your bathroom needs. A sure sign that you are pregnant is the need to urinate frequently. Another sign can be constipation. If you notice either of these things, they can be signs of pregnancy. Watch out for dizziness. This is a common side effect of pregnancy. You may get dizzy very easily when you stand up, or you might faint or nearly faint at strange times. If you've noticed this, you may be pregnant. Knowing for sure. Take a home pregnancy test. You can find these tests at your local drugstore or at a supermarket, usually next to the feminine products or family planning products. Take the test first thing in the morning as soon as you realize your period is overdue. Most people urinate when they first get out of bed in the morning. The test will be most accurate at this time. Follow the directions on the package. Most pregnancy tests are pen-like devices with a test strip that extends out of one end. Place the test strip in your urine stream when you go to the bathroom. Wait for the results. The package directions will be clear about how to tell if the test is positive or negative. Usually, you'll get the results within moments of urinating on the test strip. If you test negative but your period still does not come, then take the test again in a few days. You'll have more pregnancy hormones in your system, which can be better detected by the test. Get tested at a doctor's office. Although modern home pregnancy tests are highly accurate, you may want to be 100% sure. You can either take a confidential urine test at a family planning clinic, like Planned Parenthood, or a blood test at your physician or gynecologist's office. Even if a urine test is positive, your doctor may draw blood to confirm that you are pregnant. Although urine tests are highly accurate, they are not perfect. Evaluating your options. Consider whether or not you want to be a parent. For some women, pregnancy is one of life's most exciting events. For others, however, pregnancy can provoke feelings of dread. If you have been trying to get pregnant, or welcome the surprise, continue to how to have a healthy pregnancy. If you're unsure, talk to your partner. If you are a teenager or young adult, no matter how frightened you are, talk to your parents or to another adult that you trust, like a family doctor, a counselor, or someone at your church. Finding yourself pregnant unexpectedly can be frightening, and there is no reason you need to face this alone. Research your options for ending the pregnancy, if this is your choice. If you want to end your pregnancy, you will want to know what options are available to you. Some have more side effects than others, and you will want to decide what is best for you. The abortion pill. If you're in the early stages of pregnancy, then you can take the RU486 abortion pill. The pill thins out the lining of your uterus so that the fetus doesn't get enough nourishment to survive. In clinic abortion, before 16 weeks, a doctor will perform a vacuum aspiration that will remove the fetus from your uterus. After 16 weeks, you will have a D&E, dilation and evacuation, that will involve dilating your uterus and surgically removing the fetus. Know the laws of your state. In some states, you will have to get your parents' permission if you're under 18 and want to have an abortion. 2. Research the option of adoption. If you want to have the baby, but you feel that your baby would be better off in another home with another set of parents, then giving your baby up for adoption can be one of the most loving decisions that you will ever make. Talk to the father. In many states in the United States, the father has to give his consent before the adoption becomes official. If you are under 18, you need to talk to your parents before making a decision. Decide what kind of adoption you want. You can go through an agency, or you can hire a lawyer to arrange an independent adoption outside of an agency. Independent adoption may or may not be legal in your state, so check upon your state laws. Choose the adoptive parents carefully. Some pregnant women answer personal ads placed by couples who want to adopt, and some work with their lawyer or agency to choose prospective parents. Other couples arrange adoptions through their church, mosque, or synagogue. Know what adoptive parents pay for and what they do not. In many cases, they will pay for your prenatal care and other medical expenses. Your state probably has strict laws about what adoptive parents can and cannot pay for. Make a decision that you can live with. Ultimately, it is your body and your decision. Know that you have options, and you have the power to make the decision that is right for you.